Hi, everybody. My name is Randy Weingarten, and I have done many a town hall during this period of COVID. And this one is a different kind of town hall, but I'm really glad that we're doing it. We're doing this town hall with Open Schools USA, and I want to make sure Eric and Michelle just wave so that everybody sees who you are. Eric Hartman and Michelle Walker, who are two parents who help run Open Schools USA, and they will be moderating this panel for us with me for us because we're doing this together. And during this, we're going to do brief opening remarks of Michelle, I think, and me, and then Eric's going to do some closing remarks at the end. And then we're going to have panelists who will have a chance to ask each other some questions. Then we're going to share questions that have been submitted by activists, parents, educators, and let panelists respond. And three of our four panelists are with us right now. I just wanted you to see their faces before I do my opening remarks. Dr. Erwin Redliner has not gotten on yet, but he's going to be with us. Dr. Tracy Hogue. Tracy, would you just wave? Dr. Patrice Harris. Dr. Harris, will you just wave? And Jay, I'm going to try to get this right. Dr. Jay Bachara. Did I do it right? Dr. Jay Bachara. And so, and they, Open Schools chose two speakers. The AFT chose two speakers, and we're going to try and have the kind of conversation that, frankly, everybody kind of yearns for in this very, very, very polarized, unfortunate environment that because we're all about helping make sure that our kids get a great education in safe schools. So before I start, I just want one ground rule that I just want to make sure that everybody who's listening hears, which is, and this comes right from Facebook. We ourselves have a code of conduct when we do other things, but I'm just going to read the one from Facebook, which is, as you join the conversation in the comments, please keep in mind, just as we encourage debate and the spirited exchange of ideas in our workplace, we strive to reflect these practices in our Facebook community. However, hate speech, slurs, profanity, misinformation, disinformation, abuse, and other personal attacks will not be tolerated towards other commentators, AFT officers or staff, Open Schools USA volunteers, or our guests. Comments are subject to moderation and deletion, and repeated abuse may result in removal from this page. So, we want to really have a really good discussion. We want to have a really good discussion. I just heard that Dr. Redliner will be here in a minute. We're just keeping everybody on so that you see everybody. And as soon as Dr. Redliner gets on, then we'll, I'll finish my remarks. You'll see me, and then you'll see Michelle. So how did this start? We frankly have different viewpoints, and Eric and Michelle and I have spent any number of hours in Zooms or on the phone or on texts, but it started, frankly, in a very adversarial way in terms of, people, as Michelle is laughing, I got some very dicey direct messages and emails. And in the midst of that, there was lots of misinformation and disinformation about who the union was and what the union was doing and whether we were keeping schools closed or what we wanted to do or not. And then we started having conversations. And I'm not saying the conversations were easy, and I'm not saying we've built all the trust we need to build, but we started conversations because parents and teachers have to talk to each other. We have to regain that kind of trust that in some ways COVID has dissipated. And so part of what we tried to figure out is, are there things we could do together? Are there things we could do using our platforms, using other platforms? Can we answer questions together? Can we work together? And in fact, what we did was we put together a shared mission for this and maybe other work we do. And I'm going to read you that mission, which is, parents and educators agree that the safety and health of our students and school community is paramount. It is in all of our interests to have a safe and healthy reopening of our schools this fall. The political polarization of COVID and the changing circumstances with the Delta variant has left parents and educators with questions about safety protocols. And while we have different views about masks, and you're going to hear that today, it's important to have experts answer questions about the use of masks in schools and the cost of benefits of their use. Open Schools USA and AFT are joining together with experts to answer these questions. We want to hear from a range of informed voices about how we keep our students safe and in school this fall. And that is really what we're trying to do today. We're trying to actually figure out ways. We believe that there's been lots of ways that are proven in science. Others may disagree with us, but we're trying to have some articulation of these kind of concepts, have experts and speakers talk to us about this, and have the ability of parents and educators to be able to ask questions. So from our perspective, listening to the science, and when I say our perspective, I'm talking about AFT, we believe that the tool to open schools and keep them open is safety. And we believe that relying on the CDC and AAP and others, that we believe that vaccines and layered mitigation, including masking and ventilation and testing, is the way at this moment of time to reopen schools. And we've been pretty vigilant, as you all know, about that as the AFT. But we know that people disagree. And in some ways, that's part of the discussion today. And part of that disagreement, if you really hear it, is a risk analysis and a tolerance of risk and things like that. And I think Tracy and Jay talk about that a lot. But part of it is also a cultural issue and about who we are responsible for. Do we have responsibility for ourselves, or do we have responsibility for ourselves and others? And the AFT comes out and says that we have responsibility for not only ourselves, but ourselves and others. And that's part of why we lead with public health. So that's where we are. And we think, there's been new studies in the last, couple of weeks that actually have created clarification. The data from Arizona that the CDC came up with about, states that lack mandates were about 3.5 times more likely to have outbreaks, or the study from, 500 counties in the US that counties without mask mandates in schools had more than twice as many daily pediatric cases. But at the end of the day, and this is probably the most important thing I'm going to say, because it's obvious, my position and the AFT's position about universal masking and pro-vaccines and things like that. But what is really important is that we have to be able to talk to each other. And we have to see, as parents and educators, how we create the kind of respect that we need to educate kids. Because at the end of the day, we can disagree, but we ultimately are together with a shared goal, which is we have to have schools open safely, keep them open, and do what's best for our kids, and do it in a way that we can reclaim the ability for parents and educators to really talk to each other and work together. And that is what we are driving at today. And that's why we put this together. Hey, Erwin, it was nice
Hi,
to
everybody.
thank you for being there. And so with that, thank you. With that, and that's our fourth expert. And so with that, I'm going to just turn it over to Michelle to also do introductory comments, and then we will introduce our 4 panelists. Thank you, everybody.
Thank you, Randy, and good evening, everyone. I'm glad that she touched a little bit on the kind of how this came about and the relationship that she and I have had for a while now behind the scenes, trying to find a place of common ground to help kids and teachers' schools. My name is Michelle Walker. I'm part of the grassroots parent-led coalition of parents just trying to get schools open and do what's best for kiddos. I'd like to first give a special thank you to the panelists for taking time out of their busy schedules to be here this evening to discuss a topic that's sensitive as it is divisive. What most people do not know is that practicing physicians are prohibited from speaking against the CDC guidance. Dr. Hogue and Dr. Bachara are able to speak on the topic as they're research scholars and doctors in their own rights in respective fields, among many other things. But by and large, your regular doctor that is part of the insurance and medical network cannot speak against the guidance, or they risk losing their job or a lawsuit. That said, it's created a somewhat artificial consensus, partly due to the consenting professional point of views being muted and the public view only hearing one side of the argument from professionals. The pandemic has taken its toll on Americans, physically, emotionally, mentally, and socially, especially the relationship between public education and families. I can say that we've probably all felt that bond break throughout the last 19 months. Everything compounded and combined with the lack of data and information being shared across all aisles and our recent collective inability to empathize, we've nearly severed the relationship in its entirety. We're all entitled to have our feelings. We have all had our moments where we may have said something out of anger or frustration without thinking about it. The only way we can learn to live with the virus while minimizing risk, mend the relationships that have suffered as a result of heightened emotions, and unite parents, teachers, public education, and Americans as a whole is to cross the lines and talk to one another. We need to start open dialogue, have conversation with the opposing sides, find common ground, and perhaps even work together to find creative solutions at meeting a shared goal. And I can tell you that I never in my wildest dreams thought I would ever speak with Randi Weingarten, let alone agree with her on many things. Not everything, but on quite a bit. So it's crucial to hear both sides and to try and understand one another. It's the only way we'll get out of this, and you never know, maybe you'll make a friend or two. And with that, I'd like to introduce someone that I've never met in my entire life, but I've met because of Open Schools USA, and I'm fortunate enough to now call him a friend. And with that, I'd like to introduce Eric Hartman from New York. Eric?
Hi, I'll just give a quick introduction. My name is Eric Hartman, and I'm a father of two crazy little boys. And I own a small business, and before COVID hit, I was minding my own business and doing just normal stuff. And then the whirlwind hit, and here we are. I also want to thank Randi. I'll say a few more things at the end, but I'm super psyched to be involved in this. I think this is really cool that you guys are all coming together and talk about this like adults. So let's do this. So I think that the next thing we're going to do is have each of the panelists introduce themselves, take about 4 or 5 minutes, tell everybody who you are, and kind of lay on the line what your POV is on this. And as Randi said, Open Schools, we brought in Tracy and Jay, and AFT brought in Dr. I'm sorry, I'm so used to calling everybody by their first names, Dr. Hogue and Dr. Mattacharya. I do not mean to be inappropriate, and AFT invited Dr. Harris and Dr. Redliner. So I believe the order is going to be Dr. Redliner first.
Well, good evening, everybody. I'm very glad to be here, and hopefully a dialogue like this will bring understanding and help people make the right decisions in their lives and in the things that they're advocating for. And yes, it's a complicated time and a complicated issue, and I think the dialogue is critical. So I'm a pediatrician and have been working as a pediatrician or program developer since a really long time ago. I'm probably older than your grandparents, but let's say I've been around quite a bit. My current positions are I am the founding director of something called the National Center for Disaster Preparedness at Columbia University, and I direct the Pandemic Resource and Response Initiative at Columbia. I am also a professor of pediatrics at the Albert Einstein College of Medicine here in New York also, and I have been for the last, really since about the beginning of the pandemic, a public health analyst for MSNBC and NBC. I have, as somebody who's been very involved in understanding what we need to do to mitigate the consequences, the human consequences of disasters, prevent disasters, and so on. Very involved in trying to understand these mass casualty events, which go from pandemics to earthquakes and everything in between, and terrorism, and to try to make sure that human beings are as minimally impacted from such any kind of disaster as possible. So my work has taken me all over the world, really, in dealing with disasters of one type or another. And this situation over this last 18 plus months now, and being very involved in understanding and talking about the pandemic, and getting a handle on the science involved here, and what's actually going on, what do we need to do, where is this likely going, and so on, has been a very challenging period for me, and really for most physicians that actually have to take care of people who unfortunately may be exposed to or actually catch this COVID-19 virus, the SARS-CoV-2 virus. And I think I want to acknowledge that it is complicated, but also would say from the outset that we have to be careful that we don't just assume that this is just a matter of opinion where we stand on all this. It's not a question of everybody who's got an opinion has an equal opinion, and sometimes that's not the case. I have people in my own family who are in the group that has been resistant or hesitant about vaccines, and I know it's complicated. There's a lot of issues here that may or may not be consistent with the science or the evidence, and there may be really legitimate questions about how we're interpreting data. But I would like to just say, too, how much time do I have? Another minute or two there, Kelly?
Sure.
Okay. Yes.
So here's what the situation is, and I'm just looking at the data from yesterday. Yesterday we had 127,861 new COVID cases, and that brings the total number of cases in the U.S. up to 43.4 million cases since the pandemic began. And the cases are, they're going up and down. And as of yesterday, there was actually a somewhat of a little bit drift downward in the number of reported cases. What's not drifting downward are the number of hospitalizations and the number of deaths. We had in the United States 2,490 people die yesterday in one day from COVID-19, and the 7-day weekly average is now over 2,000 people every single day that are dying. And we're in a particularly difficult position because there's a lot of confusion about what works, what doesn't work, and so on. And we're having this confusion at a time where we have put millions and millions of vulnerable people, including children, in situations where the risk has actually increased, because over the last month and a half, we've ushered in some 50 to 55 million children back into schools and many into classrooms. And many of those children, or some of those children, are eligible to get vaccinated. And obviously, all the children that are 11 years of age or under are not eligible. So we have a lot of soul searching to do to say what actually works, what doesn't work. And the lives and well-being of our children are what's at stake. So what I am interested in is trying to avoid decisions made by individuals or by governors or whomever that will either increase the chances of a child getting ill or not surviving, and how do we interpret all that? But the other point I just wanted to make quickly is that, this person in my own family who's refusing to get vaccinated is 74 years old, and she and her husband, who's 72 or 73 years old, have been taking some medications and promoting some theories about what keeps them safe. And my son-in-law, who's actually related to these people, says she's entitled to her opinion, just like you're entitled to your opinion. And the important point here is this is not a matter of opinions. It's not a matter of people taking a vote on what to do. It's a matter of trying to save lives, not just your life, but the lives of others in your family, in your communities, and so on. And there are some opinions that are just wrong. I'm sure you've all heard stories about how people think that by getting a vaccine, you'll get a microchip inserted in your body, or you'll become magnetic. And you could say those people are entitled to their opinion, but sometimes opinions are just simply incorrect. The opinion that if you give your child the mumps, measles, rubella vaccine, that child will get autism. It's not correct. It's been promoted a long time ago. It's been debunked. The guy who was promoting it fraudulently, the doctor lost his medical license and so on. Yet these rumors, these assertions, these cults persist of people who feel like they can't vaccinate their kids for these childhood diseases, which could be devastating because some crazy fraudulent guy in England put out this notion that won't go away, even though it's been disproven. So with that in mind, I'm actually anxious to hear from the other panelists to see what your perspectives are, and let's have a kind of a open, honest conversation about what's going on and what we need to do. I think I'll stop there.
Great.
Thank you, Erwin. I'm sorry, you go, Eric, to introduce the rest of the panelists.
Okay. Dr. Hogue, you're next.
Okay, thank you so much. And Randy, I just want to say that I'm glad that you brought up, that some of us disagree, but I just want to say that that's one of the great things that, being together, we can learn from each other, from the things that we think that we disagree on. And just listening to Dr. Redlener speak right there, I realize, how much we agree with each other. And I think that we're going to learn tonight that we actually agree on most things, and it's just kind of the details of how we do things that to do the best things overall for our kids that we're going to be discussing. So I'm going to introduce myself. So my name is Tracy Beth Hogue. I'm a physician, physical medicine, rehabilitation, and private practice. I have a PhD in epidemiology and public health, and I'm a mother of 4. And I've been studying and publishing on COVID in children and COVID in schools since the fall of 2020. I'm a Danish-American double citizen who moved to the United States from Denmark 7 years ago. And part of the reason I became so interested in this topic is because I observed such a striking difference between the strategies of Denmark and the United States when it came to prioritizing the overall well-being of children. And Denmark reopened schools after 6 weeks of an initial lockdown in April of 2020, and they opened the primary schools first and then the secondary without seeing any increases without seeing an increase in cases in the community, and then proceeded to reopen the economy for the adults. And that has been the pattern throughout Europe, that they have been restoring normalcy and providing normalcy for children before the adults. And that makes sense given what we know about COVID-19 and its steep age gradient of risk, with those over 80 having multi-thousand-fold increased risk of death from COVID-19. And we also know that children are very vulnerable to changes in routines and loss of human interaction. And so they've really, throughout the pandemic in Scandinavia and Europe alike, been able to mostly keep the schools open, while in the United States, so many public schools remain closed, disproportionately affecting children in inner cities and from socioeconomically disadvantaged backgrounds. And these prolonged school closures and disruptions in sports and extracurricular activities had led to increases in obesity, with a doubling of the increase in BMI, mental health problems, and isolation and learning loss. And particularly with learning loss. Again, that seems to have had the greatest impact on children of disadvantaged socioeconomic backgrounds. And none of this appears to have spared them from the negative impacts of COVID-19. And I think that's what's so frustrating, is that multiple studies have shown that closing schools has not had an impact on or any major impact, at least, on the community case rates. There was a very good study from Germany, actually, that looked at this, looking at staggered times of school starts and closures. It did not find a correlation. And we need to remember that children are 20 times more likely on average to contract COVID-19 outside of school than in school. And so we also need to remember that when children aren't in school, they're doing other things, and their parents are working, and they may be with multiple care providers, or they may be alone. And the effects of the pandemic are going to travel with them for the rest of our lives. So we need to make sure that we're minimizing overall harm. Before I went to medical school and before my PhD, I worked as a teacher of special needs children in France, and the parents there said something to me that stuck with me, which they would be hesitant to send their children to school in the United States because they feel that we're not able to protect the most vulnerable children. And I think that all of us agree here, and I want to emphasize that that's a common ground between us, that we all agree that we want to protect our children, and especially those that are most vulnerable. And the question is, how do we do that most effectively? And the last thing I want to do is minimize the real harms to children from COVID-19, but we need to weigh them with the risks of other threats to their health, such as suicide, which poses a 7 times greater mortality risk. And we don't want mental health issues to increase, and we don't want obesity rates to increase and increase their risks from COVID-19 while we're trying to keep them safe. So while Europe has shown us in our own studies, including the one I was senior author on in the Wood County, Wisconsin study published by the CDC, that schools could reopen safely even before adults in the schools and community had access to vaccination, we sat back and watched obesity and depression rates soar and schools remain closed, and was mostly inner city ethnic minority students, and they are the ones that suffered the most. And this year, thankfully, most schools are open, but we are continuing down the same path of American exceptionalism with negative consequences for our nation's children. We're continuing to quarantine children when we could be using testing and tests to stay, so that when children are exposed, they are able to get a rapid test and stay in school if possible. And a Lancet study recently showed that that was equally as effective to quarantining. And we should also acknowledge there are many parents who are concerned about prolonged mask use, especially with the youngest children, who have such problems as autism, speech delay, anxiety, or have English as a second language. And we should consider that there are important reasons Europe has actually never masked children under 6, according to the WHO recommendations, and Scandinavia and the UK have never masked children under 12, as the European CDC has recommended. And they have access to the same data that we do and the same studies, and they have not been seeing unacceptable outbreaks related to not masking these children, and have continued to relax masking and restrictions on children as adult vaccination rates have now increased. And minimizing harm is a basic tenet of public health. And I hope we here tonight can focus on doing this together for the sake of our children. So thank you for inviting me to be here. I look forward to hearing from everyone.
Thank you, Tracy. And let me just introduce Dr. Patrice Harris. And Tracy, you know, your study, your CDC study, was actually what helped me think through how the layered mitigation, could really work, including masking for reopening schools last year. So I'm very indebted to your study from Wisconsin for all of that stuff.
Oh, thank you.
Dr. Harris.
Well, good evening, everyone, and thank you for the opportunity to be on this panel tonight. It looks like there is a shared goal and objective and alignment in mission, is that we all want to do what's best for children. And I don't think anyone has ever doubted that we all have that same goal. I am, again, Dr. Patrice Harris. I am a child and adolescent psychiatrist. I'm also the CEO and co-founder of a health tech startup called eMed. And the reason I was so passionate about starting that startup was because I saw early on in this pandemic the inequitable access to testing. I was very frustrated by that. I'm sure we all were. We saw folks waiting in long lines, sometimes 10 hours. They were in their cars. And that assumes that folks had a car, right? And had the privilege of a car and had the privilege, although it was certainly a hardship, of being in line for 10 hours just to get testing. And so I want to make it clear that I am the CEO and co-founder of a company whose mission was to increase access to testing and wanted to bring testing to the home for as many people as possible. I have been passionate about improving the lives of children during my entire career. In fact, early on, when I first knew I wanted to be a physician, I decided I wanted to be a pediatrician. But when I got to medical school, I really loved psychiatry and fell in love with my psychiatry rotation and the specialty, and decided to do child and adolescent psychiatry. I've also been clear about the need for advocacy, particularly advocacy for patients who don't always have a voice, and those are usually children, and also typically minoritized and marginalized communities. And so I've been involved and engaged in advocacy and organized medicine my entire career. I do want to think that this has been a very traumatic time for all of us. And three themes, again, that have been important to me are the importance of mental health. You've heard several people talk about mental health and integrating mental health into overall health. And clearly, this pandemic has been traumatic for all of us, which means we should be doing all in our power to do what we can, that layered mitigation approach to reduce the spread, therefore reducing the incidence of disease, risk for severe disease, hospitalization, and death. The other issue I've been passionate about my entire career is around diversity, particularly of the physician workforce, but really the entire workforce, everyone who takes care of patients. As I said, often we need to make sure that the faces of those who are educating our students, the faces of those who are providing services to people in this country match the communities that they serve. And finally, trauma, particularly childhood trauma. Pre-pandemic, these were issues of great concern, and certainly this pandemic has amplified those concerns. Randy asked my position. My position is absolutely a layered approach, but a layered approach to mitigation based on the science and the evidence. Dr. Redlener said, absolutely all of us are entitled to our own opinions. We are entitled to our own beliefs. We are entitled to our own decision making. But I am committed, that's been my personal commitment, to be in the arena. Often I've been the only one in the arena. And it is okay if we disagree. We have to have these conversations, but my commitment is to make sure that people have data and information based on science and the evidence so that they can make appropriate decisions. There has been so much misinformation and disinformation pre-COVID, but certainly during COVID. And we've seen that misinformation and disinformation sometimes disproportionately impact minoritized and marginalized communities. So that is certainly my commitment. But often we look for a one-size-fits-all approach, or the one thing. And it's not the one thing. It's all of society. It's all of the above. And so absolutely we need testing. And I agree, we need appropriate ventilation systems. We need masks when appropriate. And I hope that everyone is vaccinated, because it is all of those that will end this pandemic, or at least the acute phase of this pandemic. So again, I am happy to be on the panel. Look forward to the discussion. Michelle, I do want to say one thing that you said that was not correct. I have not seen evidence of this, but you can certainly give any evidence. Physicians are not prohibited from speaking out against the CDC. Physicians don't lose their right to free speech just because they are physicians. So physicians speak out all the time. So I'm not sure, but I just wanted to make sure that that was corrected. And I can give you a specific example. I won't go into details tonight. We're not talking about the opioid epidemic, but during the opioid epidemic, I was a chair. Oh, by the way, I am former president of the American Medical Association. I'm not representing AMA tonight. I'm visiting faculty at Columbia Department of Psychiatry, Morehouse School of Medicine, and Emory School of Medicine. Again, former president of the American Medical Association, not representing them tonight. But during the time when I was in leadership there, I chaired the AMA's opioid task force, and the CDC put forth guidelines regarding opioid prescribing. And there were a couple of guidelines, most of them, just like, there are areas of agreement, but a couple we did not agree, and we were very vocal about that. So I am not aware of any prohibition against physicians from speaking out against the CDC. Any CDC recommendations, guidelines, or actually any government entity.
Thank you, Dr. Harris. Eric, you want to introduce Dr. Bachara?
Sure.
Or just, yeah. Or maybe I just did this. Dr. B, you're the last one. You are muted. Adam, could you? Good. Okay.
Okay, I wanted to start my remarks by thanking the AFT and Randy Weingarten in particular for inviting me to participate on this panel. I know that invitation itself was an act of grace and bravery, and I greatly appreciate it. I also want to extend my thanks to the many incredible teachers in my life who've helped me over the years to become who I am. I'm an immigrant to the United States. I arrived when I was 4, and I'm a product of public schools in Massachusetts and in Southern California. And I'm incredibly grateful for the opportunities afforded to me and my 3 children by public schools and their teachers. I honor them. I've been motivated in my COVID work by a deep desire that those opportunities for children receive a high quality public education, the same one that I enjoyed, stay in place even during this dreadful pandemic. The literature in health economics, which I study for decades, has looked at the question of how valuable education is to the life opportunities of children. The answer is that there is no investment our society makes that provides a higher return than the investment we make in educating our children. Even short disruptions in education have ripple effects on the life of a child. Lost education, lost learning means shorter, poorer, and less healthy lives for our kids. So what is at stake is literally our future. Education is also the best means we have of addressing the great inequalities in our society. Poor kids especially benefit from great schools and great teachers, and have been harmed the most by the closures and restrictions over the past year and a half. To the teachers listening today, I want to say thank you. What you do may be the most important job there is in our society. I say this with a little bit of immodesty because I too am a teacher, and I find working with students is the most fulfilling part of my job as a professor in the School of Medicine at Stanford. Now that I've made the case for why it's vitally important for schools to keep going, I want to turn to whether this can be done safely in the context of COVID-19. On this, the most important point I want to make is that the vaccines have transformed the safety calculus. For every adult, being fully vaccinated dramatically reduces the risk of mortality or severe disease should you get infected. The vaccines don't necessarily stop you from being infected. I can tell you my story. I was fully vaccinated in April of this year and came down with COVID in August. But they make the course of disease much milder than it would have been. For me personally, I had 3 days where I felt pretty miserable and then a week of fatigue. It would have been worse but for the vaccine. And I think my experience is typical. The literature suggests that the vaccine is 90+% effective against severe disease. Certainly, some estimates are even higher, and it stays that way for a long time. Well, what about other bad outcomes that you can get from getting COVID, like long COVID, which may linger long after you recover? On that front, too, the vaccines have transformed the calculus. Long COVID is most likely among people who've had a very severe course of disease, perhaps sent to the ICU. Recovery after a severe case can take a long time. It's more likely to produce post-viral syndrome. However, since vaccines reduce the likelihood of severe disease, they make long COVID less likely as well as the harms from long COVID. In the latest analysis from the UK, the Office of National Statistics, which has experienced a huge wave of Delta cases like we have here, the public health authorities report that the rate of long COVID at 4 to 6 months after infection is low. While about 1 in 20 recovered patients experience at least one long COVID symptoms, most commonly fatigue or headaches, the rate's similar among patients who never had COVID in the first place. It's not something that we should take lightly, but it's something that we now have a lot of experience with, and the vaccines have helped tremendously. Now let me turn to the comments that Tracy made, and I want to emphasize how important it is to understand that the United States is not in a vacuum. The European experience with schools is a very, very important lesson that we should take. Schools throughout much of Europe and the UK stayed open to full in-person instruction nearly all of last year, and this was before the vaccines. In many places, there was no requirement for students to wear masks. They avoided masks because the masks got in the way of providing as high quality instruction as they could. For instance, just to give you some sense of how the disagreement goes, the World Health Organization recommends masks on kids 6 to 11 only under certain special circumstances and never for anyone less than 6. The European Center for Disease Prevention and Control, sort of like our CDC, the analog for Europe, does not recommend masks for primary school students. For European countries that have limited mask requirements for older students as well, and some European countries have limited mask requirements for older students as well. So to be clear, millions of children in Europe are not wearing masks in school, not because the Europeans don't care about their kids, but because they, in their view, the harms from the mask to the education they provide to the kids, to the disabled kids that are sometimes very uncomfortable wearing masks, outweigh whatever benefits there may be in masking on the spread of disease. And on that, there's actually quite bad evidence. That there's not good evidence that suggests it's a critically important step. There's no evidence that kids in Europe are greater risk of severe disease or bad outcomes, or that their surrounding communities are greater risk than their counterparts in the U.S. Teachers themselves in Europe, in many parts of Europe, have had lower rates of infection than other people in the community. Schools were safer places to be than the community at large for teachers. I think you can probably hear the passion in my voice about this, but I think it's passion we all on this committee on this panel share. We all want what's best for kids in America, and I know on that we are entirely agreed. The vaccines have made it safer for teachers to conduct in-person schooling than it was last year, and the experience of schools in Europe all last year also shows that though there were some high-profile cases of transmission, schools were not the primary locus of disease spread. Given these facts, I say we teachers should ask the powers that be to let us get back to what we do best, preparing our students to live long, healthy, and fulfilling lives without fear or hindrance. Thank you.
Thank you, Dr. Mattacharya. So as Randy talked about at the beginning, the thought behind this panel is very simple, and that is a good old-fashioned discussion. We even talked about having it be like a debate, and we kind of pulled back from that because we wanted to do something novel and radical, and that's actually have you four experts talk to each other. So this is the part of the program where we actually hand it over to you guys and encourage you, if you heard anything that one person said that you disagree with, or you want to challenge somebody on, or you want to follow up on, now's your chance. Masks, kids, schools, COVID. This is our opportunity.
I think Dr. Webinar.
We all understand we're talking about a situation where last week, 1 week, about 207,000 new pediatric cases of COVID were identified. 207,000 cases. And we're talking about situations, New York, the United States, it's not Denmark, it's not UK, it's not France. It is a weird entity unto itself. We are a federal society. where states and individual communities get to make critical decisions about public health policies. And that has left us with a patchwork, a hodgepodge of consequences that have been devastating in many parts of the United States, including in the Republican states where you have a majority of the Republican counties voted for Donald Trump in the last election. Those states have the overwhelming majority of the cases in the United States. And it's raising havoc in our hospital systems. Hospitals are overwhelmed. They're losing medical staff. The fatality rates are high, and so on. So unfortunately, we cannot have in the United States, even though we'll have recommendations from CDC or the FDA, we have no enforcement possibility of any policies in this realm by the federal government. So it's left up to this kind of hodgepodge of people with different views and ideas about it. And this is one of the reasons that we have to worry about children being exposed and being vulnerable to COVID in some places more than others. And the other thing is, I'm not sure where the differences are. I don't think anybody has even suggested that vaccines aren't the first line of defense. And if it were up to me, no teacher, no staff person would be allowed to enter a school building that has not been vaccinated. I think exceptions for things like, religious feelings should not be permitted. And I don't think that testing is an option as a replacement for getting vaccinated. And we do that to make sure that everyone is protected. And when the guidelines allow for children under 11 and under to be vaccinated, every child in every school also should be required to get vaccinated. And that I'm emphasizing this because I think that's the most important frontline major defense for protecting people and also for tamping down the spread of disease. The other questions that have been controversial include things like mask wearing. And I know that there's examples in other countries where it seems to be that, going to school with or without masks has not been a problem. But I will tell you that the data is incontrovertible that masks prevent infection of this disease. I'm looking here. I just, upon this occasion of this, I just pulled a few of the articles, which I had one of them from the Mayo Clinic. And there's another one that's a major review of a huge number of studies that have looked into what masks can do. And I think I really am not aware of any legitimate data that shows that masks are not effective. And until we get that, I think we have to do the things that we know about, which includes some of the things that have already been mentioned, that we want to make sure the classrooms are well ventilated, that everyone's wearing masks, that we do the best to keep social distancing, and that we make sure everybody gets vaccinated. That's all we got, folks. So yes, it may be different in Denmark. I don't know, although I was looking at some data from Denmark, and then I got chastised by the moderators for looking, not paying attention to all of you. But I just wanted to make sure. But the situation in Denmark has. I apologize, Randy. But
sorry, I just laughed.
Yeah, in Denmark, as we've seen there was a big rise in cases in Denmark. It's not like Denmark's been somehow immune from, pardon the pun, but from a significant number of people in that country from getting infected and so on. The fatality rates are much lower, but it's a very complicated business to get into comparing a country like Denmark and a country like the United States of America, one of the most heterogeneous nations on the planet, especially in the in the highly developed countries, and it's just, I think, I'm not sure. Are we even having an argument? I don't think so. It's just we're just.
Well, I've got a few comments, Dr. Redlener. So I mean, Denmark, the hospitalizations decreased and then plateaued. So they're more looking at they are looking more at the hospitalizations right now, and we do have data out of the UK showing that children are at approximately the same risk of hospitalization unvaccinated as 40 to 50-year-old adults that are double vaccinated. And that the mortality risk for children unvaccinated is the same as or less as about a 20 to 29-year-old double vaccinated adult. And so, you know, they've got the youngest kids that are unvaccinated, a little over 50% of the to 12 to 17-year-olds vaccinated. The adult population is very highly vaccinated. So they're looking mostly at the hospitalizations right now. But I wouldn't want to simplify the situation and say that the United States is just like Denmark. But, you know, they didn't require masks of children 12 and under all along. And so in terms of the studies that we have, obviously we have the Bangladesh randomized control trial, which didn't find any effect in terms of preventing SARS-CoV-2 infection with the cloth mask, but it did prevent, it was found in the context of also distancing to prevent SARS-CoV-2 infection in people in the community over age 50. They didn't have children in the study. We do have the CDC study from Georgia that didn't find an impact of cloth masking, but they did find an impact of adult masking in schools. Of course, that was before vaccination. We have the school response dashboard, Emily Oster's group, where they controlled for community case rates. They didn't find a difference between the schools with the mask mandates and the schools without. Now we have the two most recent studies from the CDC from Arizona and the one from multiple counties. And the issue with the one from Arizona is they didn't actually control for the amount of the rise in the cases in Maricopa County. And so it was not a randomized study. And they didn't control for the amount of contact hours the students had and the increased amount of students in the one school versus the other. And apparently there was a difference in the amount of days these students were in schools. And then with the other study, they also didn't control for adult vaccination rates. This was the multiple counties study. And they looked at the cases among all the students 0 to 18, or all the children 0 to 18 in the county, and not just the students. It was only a 2-week study. I mean, those are not high quality randomized control trials. So we can't really learn a lot about the effects of masking from these observational studies that aren't well controlled and adjusting for the necessary confounding variables. So I'm totally open to believing that masking kids is going to have an impact. I just don't think that we have really solid data to say this is how much it works. And so I keep focusing on adult vaccination is so important, especially vaccination of kids that are high risk. It needs to be emphasized. And ventilation has been shown repeatedly to be an important strategy. And I'm all for, paid sick leave and people staying home and getting tested, having access to, it would be amazing if there were free tests at schools, and I think that those are the highest impact things. And sometimes in the Marin outbreak that was also published by the CDC, all the kids were masking with high compliance. The teacher, there was like some problem with mask compliance when she was reading, but 55% of the kids got infected. So obviously, if you have a high-risk child, you're not going to say, well, just wear the mask and everything is going to be fine. You're going to want the teacher to be vaccinated. You're going to want the teacher to test if she's having symptoms. And she didn't do either of those, apparently. So, I think that was the crux of the problem there.
So, and Tracy, I might say, I think we do have, some good data that masking works, but I appreciate that. And we are always, we should always be on our journey for data and looking at, but I don't think we have any data also to say, just don't wear, just don't wear masks, don't worry about it. And I think we do have data to show that really it's about, and I hate to be a broken record, and I'm almost like Dr. Redland, I'm not sure we're necessarily disagreeing. It's, masking and testing, and yes, the data is evolving and growing. The one thing I do always want us to be careful of, and you're right about Denmark and Dr. Redlander, and this is pre-COVID, I would always candidly bristle when they would compare some countries with the United States, because I don't know the specific demographics. I know that you do, but I do know that they are not as heterogeneous as we are here in the United States. And so I also and you did mention this, and so did Dr. Redlander, that we just can't, sort of take data from Denmark and say, and because it worked in Denmark this way, it will work here. So I just don't see, and certainly there are individual differences, and you're right, it's about the rate of the community spread. And this is where I get to individual school districts and local public health departments working together to make these decisions, rather than any folks sort of just saying this is the way it should be across this country. You will have a different outcome and different set of strategies and tactics for a county with a low vaccination rate versus one. So I just want us to, I hope that we realize that the decision should be driven by science and data, but really at the local level, and let them make the decisions that need to be made.
Right. Yeah, I'll just add that we also have studies from Catalan, Spain, where they actually found the lowest rate of transmission in the schools from the youngest unmasked kids. So that's a little bit more heterogeneous population. And then we have the UK that also did not mask kids under 12. Obviously, the UK has had high case numbers. I'm not saying that they haven't, but they've had an exceptionally low mortality rate and hospitalization rate among children. So, I realize that it is a little bit comparing apples to oranges, and we need better studies if we're going to say that masks have like this X effect, especially cloth masks, which is what most children are wearing.
Yeah.
So Tracy, there's a whole other line of research which is very basic, which says, and this has been studied a lot, that a mask will prevent the transmission of the virus from one person to another person. That's not about an observational study or an epidemiological study. That's simply in very competent labs that say, if you're wearing a mask, the chance of you spreading the virus to somebody else is much reduced. There's no controversy with that.
So, Dr. Redler,
not all the masks
depends on someone wearing a mask.
Detail of that, but masks work to prevent the spread of virus. Then you get to the other level of looking and sort of observing this population versus that population. There are so many variables there that I'm wary of drawing too many conclusions about it just from these observational studies, which may be observing different populations with many different variables, some of which we're clear about, some of which we're not. And the other thing, of course, is that it's not just what's happening in the community. In the U.S., originally, we were seeing maybe of the reported COVID cases, about 14 to 16% of those cases being pediatrics. Last week, it was 26% of reported cases of COVID in the US were among children. And I just think we have a brewing problem here that we need to be all out in trying to make sure we're doing the right thing, which I think all of us on the panel and the moderators we all agree with. Vaccines first. Masks, I think we should be doing it. And you have to show me that masks do not help prevent the spread of the virus. And, let's talk about that if you would like to.
So let me try to address the mask, because I think that's probably the central area of disagreement, because I think we all agree that vaccines are incredibly effective at protecting the person that gets infected, that gets the vaccine against severe infection. The evidence on masks, I've been evaluating epidemiologic data for decades, is incredibly weak. The mechanical studies that show that masks prevent droplet spread assume that you're wearing the mask appropriately, and children just don't. They just, as a general rule, it's difficult for children to wear the mask appropriately. There are randomized studies from before COVID, dozen and more randomized studies on whether masks protect in settings where people do know how to mask appropriately, in healthcare settings that find, for instance, with the flu, the masks don't protect against disease spread and also not against source control. So we're not operating in an environment where we know nothing. We're operating in an environment where there's a reason why, for instance, that the consensus in February of 2020 was against masking, because there was no good evidence that they would work on a respiratory disease. And what we've seen here in this context is you have two randomized trials, one in Denmark and one in Bangladesh, neither in children. The one in Denmark was entirely negative, and the one in Bangladesh was marginally positive for for surgical masks, which are not typical actually in schools, and insignificant at all for cloth masks. And it was only the effect was only found for people 50 and above. So I think we don't actually have very much evidence supporting the use of cloth, supporting the use of masks in schools. Now, what we do have also is it's not just you should think about what we can do at whatever we need to do to stop it. We also have to consider the harms. Many teachers have written to me and told me how difficult it is to teach with masks. It's hard to, it's a variable thing. It may differ from one place to another, absolutely. And some teachers would be better at it than others, absolutely. But as a whole, it's not enough to say that on average it's okay. You have to say for the most vulnerable, it's still okay. But I don't think I know that. There are costs and harms.
But Jay, let me just say, I'm sorry, because you've invoked teachers overwhelmingly at this moment. No teacher wants to teach forever in a mask. But what teachers tell us, and we have lots of data on teachers, that given the Delta rise right now, and I think the right now becomes really important. Like, what's the off-ramp of masks? No one is saying that we should have masks forever. And I'm just interrupting because teachers have overwhelmingly written to me about how do we keep things safe? And overwhelmingly, our membership at this moment, even though you're right, they don't like teaching in masks. We want to see kids' faces. We know, I'm an asthmatic. We know that we know that it labors breathing. But overwhelmingly, to keep schools open at this point, teachers are really willing to be in masks, even though they know it is not perfect and it doesn't, the best way to teach is without it. I just wanted to raise that in terms of what teachers have said to me.
I mean, I think teachers are amazing. I mean, they're going to do what will try to keep their kids safe and do the best they can. I think that's what's happened through the pandemic. But I think the question is it necessary in an environment where basically every teacher has been vaccinated or has had access to the vaccine? Their risk is much lower. Is there evidence that the masks actually work? I mean, as you've heard from Tracy, there isn't strong evidence it has worked.
There is evidence. I don't want to get involved in the middle of this. I'm sorry. It's just there's 2 new CDC studies that, just like somebody could pick apart every somebody could pick apart every study. But what I found interesting is that last week there were 2 new CDC studies that said they seemed to work and that it seemed to be a really big decrease. There was a difference between places where there was masking versus not. But all I'm saying is, and I know we have to kind of move, Eric, to the question period from the unless you want to,
Can I
not
make
ask
one more
question.
comment?
Yeah.
And then I'd like to after
Okay, these 2 comments, Tracy and Patrice.
I just want to say that, with regards to those 2 CDC studies, I don't want to go out into like really great detail, but just as an epidemiologist, there are very concerning things about those 2 studies. I'm not saying that there was necessarily no effective masks, but that I've corresponded with at least one of the head authors, and there are issues that will need to be adjusted in publication, and we're not able to learn a lot about masks from those 2 studies, according to the way that I view it. And in regards to our Wisconsin study, I do want to say that we had a very low rate of transmission in our schools, very similar to what's been seen in Europe, but we didn't have a control group. So we weren't able to determine what the effect of masking was. And the other thing that I just want to bring up is I do not doubt that masks can have an impact in preventing disease spread. And I wore an N95 every day before I was vaccinated in my clinic with like eye protection, and so I do believe that masks can play a role in preventing getting COVID. But the thing that I see with kids is that they're wearing these masks all day. They take them off to eat lunch. They're not, their compliance isn't 100%. They're hours and hours in them with each other in the same room with a piece of cloth, over their face. And with this being an aerosolized spread virus, I think that's part of the reason that we're not seeing these strong effects of the mask working in the school environment. And then I'll just also bring up the fact that it's concerning that kids are also having to wear masks outdoors just in terms of like, they should be able to be exercising and have PE and normal recess, where they can at least like see each other smile and feel like they can run without getting winded. Now I'm a runner, and if you've ever tried to run with a mask, it's extremely uncomfortable, and it just gets wet. And so that's just an anecdote, but I think that's probably why we're not seeing very strong effect of the masks in the schools. But if there were a good study that was randomized in schools that showed an effect, then I would be, I'd jump right on that and say, well, now we have good evidence that they're working.
Same here.
The only thing I would say, and Doctor, thank you, because you mentioned you didn't have a control group. And I think we have all said, we need more data and we need more studies. By the way, I had not heard that kids were being forced to wear masks outdoors, but
California, yep, everywhere. Well, not in the private schools, only the public schools. From what I've seen.
But to both you and Dr. B, I would just say the one thing I've heard tonight is they're not wearing masks all the time in 8 hours, and they do take it off. And I know kids might, take it off and then they're not wearing it correctly and they don't have the right ones. And I would just say that makes me believe that we need to make sure that they have appropriate masks. What are we doing as a society, right? And so that should not be the excuse because they're not wearing it correctly or it's too hard. Dr. B, I agree that it is more difficult to teach probably because I'm a psychiatrist and we learn a lot from one another and communicate non-verbally, but there's a risk benefit here. And, in a perfect world, we wouldn't have COVID. So I just think we should make the right thing to do, the easy thing to do. And just because something is hard doesn't mean that we shouldn't do it or it doesn't work.
So I have a philosophical question, which is, with us, why is the burden of proof being on we need evidence that masks don't work, whereas in Europe and Scandinavia, it's more been, well, we need to have evidence that they do work in schools, or we need them in order to start using them. This is something I've thought about a lot, and I don't know why there's that philosophical difference.
Well, Tracy, can I just, and I know we have to get to the questions, but also let's talk about the other philosophical differences between Denmark and Sweden, where kids were a priority, not opening the economy.
Right.
And,
right.
And so what ended up, and you see huge vaccination rates, and you just see so many other things that made, so I think that the problem we all have, and just like you, I've been on many calls with UNESCO and WHO, and and sorry about my dog, she is just started barking, so I decided I would hold her, so, you wouldn't have to hear the barking. But
that's a good thing.
This is Penny. She's saying hello.
Penny.
But she's, but I do think that there is an issue here in terms of the federal system that we have in 50 states and different standards versus in a state like, or in a place like Denmark or Sweden or even Great Britain or France. There's one central way of doing public health. And I think that's a huge difference, unfortunately, for us.
Yeah, no, you're right, because the adult vaccination rates in the Bay Area are actually equal or higher to what they are in Denmark, and all the kids are masked outdoors in the Bay Area. It's a strange disconnect, I think.
And I'd like to go back to the point that you made before, Dr. Hogue, which is the burden of proof argument. And that's one of the points that Michelle and I and a lot of parents have had and have struggled with, which is, masks are not normal, right? Like, we didn't do this before 2020, and we didn't do it for a reason. And normally you have to prove, beyond a shadow of a doubt that something works, that there is repeatable, provable efficacy. And we're going back and forth with study versus study, and there's a lot of mannequins and there's a lot of this and that. But to Dr. Hogue's point, doesn't the burden of proof have to be, from a public health standpoint, doesn't it have to be on the mitigation to prove that it actually works in order for us to do this to our children?
Can I add one point on top of that? we have a limited amount of energy to spend. We have to, in public health, when we spend our energy on high yield items, it builds trust in public health. It builds sort of compliance, and you just get good results. When we spend our energy on controversial things with less good evidence, it squanders the energy we might have to work on the most important things. I think we all agree that vaccines are the single most important mitigation measure, right? I mean, that's what I heard from Dr. Harris and Dr. Redlener. I think that, and I think that Dr. Hogue, we all agree on that. The problem we're currently having in the United States is there's very large numbers of people who have lost trust in public health. That's why we're seeing this vaccine hesitancy, and a lot of that has come from that public health pushing things on which there's only marginal evidence, incredible amounts of energy spent on that. Whereas the most high yield items, there've been much less energy. We've essentially created the situation where large fractions of the population no longer trust public health. We've taken something like the anti-vax movement, which Dr. Redlener mentioned, which is very unfortunate regarding MMR vaccines, a terrible thing to not give your kids an MMR vaccine. And it was a fringe movement. And now we've turned it into something much more mainstream, essentially by demonizing half the population, creating political divides around this, and putting all our energy in things that are on putting so much of our energy on things that are low yield. I think.
Well, Jay, listen, we're in the middle of a crisis. 207,000 children were infected last week, not last month, last week. Kids are being admitted at high rates to hospitals. Pediatric ICUs are overwhelmed. And we don't have time to luxuriate in some of these decisions that have to be made by experts. Do you think that Dr. Fauci and Walensky and that whole architecture of public health expertise in the federal government is just making this up to entertain themselves or be controversial? You know, Fauci, early on in the epidemic, in the pandemic, was not a big supporter of mask wearing, for instance, but soon changed his mind because we didn't have a vaccine, we didn't have much else that we could offer, and right now we have too many people unvaccinated. So we're basically, for many populations, more or less where we were in the beginning of this pandemic. So I think, I have 7 grandchildren, and they're all in the public health system other than the 2 that go to college. And, I don't want those children at risk. And if you're waiting for me to prove, undeniably and without any issue that they are, in fact, that masks work, they probably do work. And there's a lot of studies that say they work. And the actual ability of masks to slow down the spread of virus from one person to another is the fact. And the fact is that some masks are better than others, I think, as Tracy pointed out. But the reality is that, and kids will not wear these perfectly. My 5-year-old grandson has just been told in his kindergarten class that all the kids have to wear masks. He's doing it. Is he doing it perfectly? I don't know. Is it the best possible mask? I don't know again, but I really would prefer him going to a school based on the globality of everything we know. I prefer him to be as safe as possible, which is what I prefer for all children, which means nobody, like I said in the beginning, no adult gets in the school building that's not been vaccinated. All children who are eligible get vaccinated as soon as they become eligible. We're still trying to make sure the ventilation systems work. And by the way, there's a lot of potentially controversial information about ventilation, but everyone's accepted that we need to have good ventilation in the schools, and we need to have masks until proven otherwise. Yes, it is a little bit reversed, but we're in the middle of a deadly crisis, and I think we have to look at the balance of information and the studies. And my conclusion is, let Orrin be a little uncomfortable, but he's actually gotten totally used to it in the last week. So I think that, that because it's not perfect, it's not a reason not to pursue it as policy.
And if Jay, I did want to say, so first of all, I think we are probably just not going to agree on masks. So I think Dr. Redlener and I both think that we do have data that show masks work. Is it, perfect and in every study? And as Dr. Hogue mentioned, comparing apples to oranges, but I feel comfortable based on my analysis that they do reduce risk, and I will tell you for my money, it's worth that. Eric, I hear you. You talked about it's not normal, but there's going to be a transformed normal when we get on the other side. And let me just speak individually here. I plan to probably wear a mask a lot more during flu season. Let's just say we're over the acute phase of COVID. So masks are a little bit. We're not used to them, but they may be a part of our new normal. And I don't think there's anything wrong with that as long as it lessens disease burden. So let's not believe that we don't need to transform how we do a lot of things on the other side of COVID. I'll just say another thing that I think we need to think about is how we greet one another. I like hugs. Hugs might be safer than handshakes, but I think we're gonna have to think about that too. So there's a lot of things that are gonna be different on the other side of this. Hopefully, if we learn anything, rather than just saying, we're just gonna go back to the way we were doing things before. And for so many reasons, I hope not. People say to me, Dr. Harris, when will we get back to normal? And I say, I hope not, because pre-COVID, a lot of people didn't care about health inequities. Yet people are talking about that now and talking about minoritized and marginalized community. I've talked about it, but a lot of people weren't talking about it before COVID. So there are things that we were not talking about before, mental health as much. Jay, you mentioned public health infrastructure. Underfunded and under-resourced for decades. And now hopefully we'll learn a lesson and that will be our new normal. So I think just wanting to go back to the way things were, I think means that we are not willing to learn the lessons of this moment.
I agree with that. I don't think we're going to go back to exactly the way things were, but I don't think masks will be part of it. 14 randomized studies with negative results on flu control. Even in healthcare settings. I think you have to follow the evidence. I think in medicine, we don't do things without good evidence. We don't assume that we're going to do it, it's going to be fine until proven otherwise. We do things only when we have good evidence. The reversal of it, the fact that we're in a crisis is not an excuse to skip that step, because it tends to cause harm. And, Randy, you mentioned the teachers are telling you that they're willing to wear masks, but it does hurt their ability to teach. I can tell you that from a personal point of view, it's hard to teach with a mask.
Yeah.
So I think that we have to remember there are costs to this, harms to this that are not. It's not just a trivial thing.
I'm just
looking at we have an end time at 7:30. I love this, but I'm going to just look at Eric and Michelle. Do you want to continue this to the end, or do you want to ask the questions? What do you guys want to do?
I think we had a couple good questions, but I felt like that we were just starting to get to a little bit of a core issue here.
Okay, then why don't we
Dr. Hogue respond if that's okay?
Yeah. Then why don't we just let this go to 7:30 and just not, and then do it that way? I just wanted to this is.
We should do this again, though.
So let's do this to 7:30, and then we can the three of us can kind of get one or two of the questions that were asked. We'll ask the experts those questions before 7:30. But Tracy.
Yeah, so I just want to say, I think that we all agree we don't want children to get sick. We don't want children to suffer. We don't want adults to get sick either. And the thing that I think parents are expressing is like a lack, I guess, maybe of empathy and understanding about the kids who are having trouble wearing masks or learning. And like in our country, I know that they're not in school yet, but like that 2-year-olds are having to mask, and that kids are struggling to maybe learn language to connect with other children, and their faces are covered. And I think that basically if adults and parents in the United States felt like there was empathy and answers to their concerns, and like people who were vested in looking into how long we're going to mask, when it's going to end, how important it is, that they would feel more understood, and that there would be more trust in public health. And I think that is why, one of the reasons why there's so much trust in public health in Scandinavia is because they have all sorts of exceptions for people who can't wear masks because, of health problems.
Can I ask all four of you that question? Because you all have raised the issue, and Michelle and Eric have raised it as well. the great distrust about our institutions in the United States, including public health. And Patrice, sorry, I'm just talking to everybody as first names. We've been on this panel for an hour.
Please
so,
do.
Yeah, thank you, Erwin. So, Patrice raised the issue of the underfunding of public health in the United States, which isn't the case in Denmark and Scandinavia. But maybe there is something here about what would create trust in agency, particularly given all the disinformation that's out there. Like Jay, when you were announced on the panel, I got a lot of tweets about the Great Barrington Declaration. And did you say that teachers, should die or things like that? And I know you didn't, but, this was, you look at it, this was the disinformation about you. And so the question becomes, what would create trust about, because of course there's empathy about, all of us wearing masks. I'll say for me, I don't want to wear a mask, but I do it to protect other people. So what would create trust?
Transparency, I would say, about what we do and we don't, what we do know, what we don't know, what the relative effect sizes are of what we're doing, what the relative risks are. I think people they want nuanced information. They want, adults don't want to be treated like they don't understand science. Like they want to know, how important various things are. Like we've kind of overemphasized probably the effectiveness of masks and underemphasized the effectiveness of vaccines. I mean, I know we've already brought that up, but that's just one example. And we can't make people believe that, wearing a cloth mask is going to 100% prevent them from getting COVID, because we know that that's not true. And so people just need some, rather people see the CDC flip-flopping on issues rather than just stating from the beginning, well, we actually don't really know how effective masking is, but we're going to do it for this amount of time until this. And, just give some more information about the thinking process. And I know that's what the European CDC does, that they're open about, well, masks are probably one of the less effective prevention strategies that we have, whereas testing and staying home when you're sick and getting vaccinated, those are more, high impact strategies. So we want nuanced information like that.
So Tracy, I think your point about messaging, let's say from the CDC, that's been horrendous. And I agree with you. And I've been in touch with them and other very senior officials in the administration. This has been a calamity of bad messaging strategies that has definitely undermined confidence and certainly has caused confusion. I get asked about this all the time, and I think that's a problem, and exactly for the reasons you stated. But let's just talk for a minute about the big elephant in the room, which is the politicization of this public health battle. It's one of the most horrendous things I've seen in my pretty long career now. I've never seen this political intrusion into a major crisis that needs to be solved by science and evidence. Kind of like the discussions we're having here. That's fine. What was not fine was Donald Trump spending 4 years undermining scientists, driving some of our most productive scientists out of the federal agencies, and create a movement of anti-vaxxers who have nothing to say about evidence or messaging. They've been convinced that the Trump cult, which is his legacy, gives them the freedom to spout BS as a way of sort of dealing with this. I think that's a really unfortunate. I don't know how we're going to get out of this, but it's not going to be because you and Jay or myself and Tracy are giving more, more information, more data. Something more fundamental is going to have to happen. I don't know what that is exactly, but this is a political disaster, not a public health messaging disaster or data disaster. And that's, I again, you can hear I feel pretty strongly about it, but having spoken to many people and many organizations where there's no willingness to even listen to data, yours, mine, Jay's, they're just not interested because Trump himself got booed a few weeks ago because he suggested to some political rally that people should get vaccinated. He was booed off the stage, or booed loudly. So I don't know how we can deal with that, but I at least want to not leave the evening go by without telling you that I feel pretty strongly about the horrible politics that have intruded on the work that should be conducted by scientists like you and like Jay and others that have a rational disagreement about policies. That said, I still believe that we need to give every edge possible to preventing disease spread among children and in schools. And I don't see how we could avoid doing masks. And I don't think the observational studies comparing country A to country B shed much light on that.
So why don't we let everybody have the last word, since it's 7:28, and then Eric, you get the last word.
I'll say trust must be earned, and I think that Dr. Redlener said that is the elephant in the room. Tonight we had debates about policy, debates about science. That's the way it should be happening. But unfortunately, the divisive political discourse right now and the misinformation and disinformation on social media is not helpful. And I will say, I know we could have an entire panel about vaccine hesitancy, and we have to be careful not to lump everybody into one group. There are so many subcategories of the reasons why people were hesitant. Actually, I don't even use that term anymore, but I just want to make sure that we don't lump everyone who had questions with folks who are the anti-vaxxers. And thanks again for the opportunity.
Thank you. So I think this is the central question of this pandemic. How do we build trust? Because I completely agree with Dr. Redlener. That has been the biggest failure, and it's caused enormous harm. I think people are dead that would be alive but for it. I think, although I do think that part of it is this politicization. It creates a distrust that runs in both directions. I think public health needs to be seen as entirely politically neutral. And what I hear from folks, that are on the right, is that they feel like they're looked down on, like they're disdained by public health. I get grief when I go on Fox News because my view is, I don't have a party. I have never registered for a party because my view is, as a public health person, I want to be able to talk to everybody, whatever their politics. Public health has to be for everybody. So we have to find a way in public health to talk to everybody in ways that they look up to us and say, look, yeah, those are trustworthy people. What's happened in public health is there are large classes of people that think that public health is talking down to them. That's caused enormous harm. I don't know how to fix that, and I wish I did.
Yeah. And I just want to say thank you to Randy and Eric and Michelle right now, because I'm not leaving, but I just want to say that that scientists have been very afraid of speaking up and even just questioning the most basic things because they're afraid of getting attacked or losing their jobs. And I think that's another problem in this pandemic, and the way that it's bled over into the way we've treated schools and handled the schools, is that if people aren't constantly viewed as maximalists, doing everything possible, hazmat suits, everything all the time, it's like, then they're discredited or accused of being a, extreme white right winger, which, I'm just like Jay, I never talk about politics because that's just not, that shouldn't be important to this conversation. And so that's another thing that worries me in addition to the CDC messaging, is that scientists are also feeling like they need to be silent.
Absolutely.
Eric.
Yeah, I guess I'll close it out. It's been a really good hour and a half. So first of all, thank all of you very, very much. Just one quick point to Dr. Harris. We actually this has been going on for about 6 weeks, our team and Randy's team. By the way, the AFT team has been incredible to work with, Randy. They've been really professional. We actually tried to get a couple physicians to join us at certain points, and both of them were prohibited from speaking publicly because they were going to take a point of view that went against the CDC guidance. One of them was told by their medical network that was a no-no. And there was a psychologist that was told by his insurance company that was a no-no. So we can certainly follow up on that discussion, but it does happen. And we've seen it. We actually know a lot of people that have been, sort of had to deal with that.
But let me just say that's based on their relationship with their employer, which people, sign a contract and they may be. But I didn't, it's like just the physicians in general cannot speak up, but people take jobs and, based on those jobs, they may not be able to speak out. But that's an employee decision.
Yes, but it is pretty prevalent right now. But that aside, what we just did was a big deal. We had 4 people, 2 on one side-ish and 2 on another side-ish, coming together and talking about, one of the many third rails that exist today. And that was a big deal. And it really shouldn't have been a big deal. And, even though I think we know how charged these things get these days, and Randy lives it every day, we were all kind of surprised because when we were talking about this, we just rewind super quick. We've been talking to Randy for about 6 months off and on. And the one thing that we knew that we shared and agreed on was the fact that we were talking, right? The idea that we were able to have this dialogue. And it really harkened back to, pre-pandemic where, you could just go and talk to your neighbor. And the pandemic comes along and you guys, everybody here said almost the same thing. It became politicized and it really brought to the fore some really icky stuff, right, between people. And you 4 in 2019, you could have easily found yourself at some industry function, hanging out, talking. You would agree on this thing, you would disagree on that thing, and then you would end up at the hotel bar doing bad karaoke at 2 a.m. So this is the fact that this is a big deal, that we're just getting together and doing a discussion like this is kind of terrible. But that's why it's a big deal and a good thing that we did this. And I know I speak for Michelle, and I want to really thank Randy. She's been really open-minded, at least to have this discussion. Of course, we don't agree on everything. We have calls where we don't agree on anything, but at least we had the call, right? And again, that's what this is. I don't want to hammer it too much, but this has been awesome. So thank you all so much.
And I just want to also share and tell people how grateful I am to all of you, because part of what we have to do in this democracy, and in some ways schools are like this, and Erwin and I have gotten to know each other a lot because I talk to him not every day, but frequently about these questions. I ask these questions all the time. What do we do? What do we need to do? I'm an educator. I'm not the doctor in my family. I'm the educator in my family. I'm the lawyer in my family. How do we deal with this? We're still in the middle, unfortunately, of a pandemic that has lots of twists and turns. We don't know things. But that question, and Patrice, you said it at the end, and Tracy, you said it too, trust has to be earned. And part and parcel of what we're doing right now, even though I don't know if we changed anybody's minds, I still believe that we have to do the kind of layered mitigation to keep everybody safe in school. That's my obligation. I feel is like, I want to have schools open. I want to keep everybody safe. And even though I don't like masks personally, I feel like we have to do that because of keeping people safe. So I don't know if we've changed anybody's mind, but this is what we've done. We've had a conversation with people who really disagree, but where we could hear each other and try to recreate trust on a local level between people who may have disagreed. And that muscle of doing that is really important if we're going to keep a society together. And so I just wanted to also end by saying thank you, everybody, for taking the risk to do this and for us having a pretty robust conversation. Thank you to Open Schools USA. Thank you to Dr. B, Dr. R, Dr. H, and Dr. H squared. And thank you, Michelle, and thank you, Eric, and thank you to the AFT staff for doing this.
Thanks to all of you. It was a great evening. Thank you.
Thank you
Thank
so
you,
much.
everybody.
It's awesome.
Bye.